And what we're gonna do, go ahead. When you take that off, turn it upside down and put it on the side. Okay, don't put the wax side down, okay, because you're making a mess and then you're cleaning it up. Anybody ever try to clean up wax? Not fun, is it? Okay. The other thing that wax is even more, way more slippery than water on the floor. Okay. Do not get wax on the floor. I don't care if it's a little bead that gets dropped, pick it up, okay? And if it gets dropped on the floor, put it in the garbage. Don't put it back in the wax machine. Again, we use the wax over and over. We don't change it every single patient. Most machines have the button where you can put it either to, they'll call it high heat or sterilizing or something. And that's something you can do at the end of the day when you're gonna close down the therapy room, because it'll get very, very hot for several hours and then take several hours to cool back down. So you don't wanna do it in the middle of the day or first thing in the morning if you're gonna have patients that need to use it, because it won't be usable then.
124.
Okay. All right, so now when she takes it out, keep it over the wax. All right, so now we have wax on the thermometer, right? All right, let it dry. It'll get opaque when it dries, and then just slide it off, let it go back into the machine. Okay. All right. Make sure it goes down. I don't want to see anybody flinging it. Okay. If it gets on your hands, maybe you want to have a paper towel here that you can then wipe it. Okay. All right. So notice that this particular machine has a little plastic plate on the bottom. Okay. We have 3 different brands here. And by the way, you can now buy these on Amazon. It used to be you could only get them through a medical supply for a medical program, and anything you can buy on Amazon. In fact, I think this one is from Amazon. Okay, so it has a little plastic plate on the bottom because the sides are metal and they're hot. So we don't want to burn them. But those other 2 do not have the little plastic plate. It may or it may not. But when you're working with your patient, and I'll show you how we're going to put her hand in there, you're going to tell them, you know, try not to touch the sides or the bottom because that's a little bit hot. The other thing that Mahira is going to do now as the patient, she's going to take her jacket off. Okay. And you're going to ask your patient to please go wash your hands and dry them very thoroughly. Right? And when she comes back, I'm going to check her hand for rashes, abrasions, cuts, but also that they're dry. Because especially, remember I said it's important to dry in the wet spaces. You leave, just little beads of water in there. That hot wax is, what did she say it was, 124? Okay. Then it heats up the water real quick, and that will fizzle, and that will be probably not cause a burn. It's going to be uncomfortable. It may cause a little red area. It might give you a first-degree burn or anything like that, but it won't be comfortable. So we talked about the dip and wrap method, which is the method we're going to use. Dip and re-immerse. I'll show you how we're going to dip, but then re-immerse means you just sit here and leave your hand in the wax for the entire time, the 10 to 15 minutes. And another reason that if you use that method, you'd want to have that plastic plate on the bottom. Okay? That's also typically not used. Too much bigger risk of burning and leaving their hand on the metal part. Plus, oh, I've got another patient coming. Now I can't use the wax. We have new wax down here. They come in these 1-pound packets. Typical is they hold 6 pounds. So these are beads, or they have solid ones. What's the difference? Which one would I want?
Beads,
Why?
it melts faster.
That's the only difference, is it melts faster. Okay, so in the beginning, when you're filling it and put 6 in, doesn't really matter, you're gonna need all day anyway. But like this morning, I think it was that one, I ended up adding a pound of wax to, because it was pretty low. So, over here, will you go and check and see if it's still, I would think it should be fully melted.
Yeah.
Okay, it'll melt faster, that's the only difference. And we also buy, and most clinics will buy, unscented wax, okay? There are all the different scents, such as used at spas and salons and things, and that's fine, but a typical therapy place uses unscented. Okay. All right. Okay, the other thing I'm gonna get ready for my patient before she. And we do want to keep this closed anytime it's not in use, and when you're done with her, done with your patient, I should say, put it back on, because the top part will start to cool pretty quickly, and you'll start to see that opaque hardening on top there. So just get it closed. All right, now here's one over. You can run with this hand? Let's check. All right, so no rashes or brashes. No abrasions. Her hands are nice and dry. Now I'm gonna explain to her what we're going to do is dip your hand in 6 to 8 times into the wax. I want your hand relaxed, okay? You don't want them to hold it stiff. You want it relaxed, gets nice coatings. You don't want them to move their fingers in between, because then it breaks the wax. If they still need to get dipped again, the hot wax will go in there, and again, that'll be a hot spot, it'll be uncomfortable. And if you do it afterwards, then again, you're allowing it to cool faster than the paraffin is working for you, okay? Have you ever done this before? We can put the thermometers in here. There's 2 of them. There should, oh, there's one over there too. Okay. So I'm gonna help her to start with, and we wanna get the wax, right up hand and wrist. So she's got arthritis in her hands and wrists, so we're gonna help her feel nice and comfortable, warm up the tissues before doing some exercises. Okay, so I want you just to dip your hand in. You'll have to move your wrist a little bit in order to go in there. Okay? So we're gonna go ahead and dip in all the way down. Now come out, just like that. Stay over it, let it drip. See how it's turning white? So once it turns white and stops dripping, it's like, okay, go again, and out. It's not real fast, but if we stay in there, it's also gonna melt the wax off. Okay, and we're gonna go down again. Okay, 3 times, and then certainly if your patient can do it, you can let them. Okay, I want you to go ahead and do 3 more dips, just like that. Okay, probably didn't wait quite long enough. Make sure it turns white. Okay, go ahead now. Okay. Was that 3 more? Okay, so we're gonna let her just drip over the tank. We're gonna do everything over the tank so the wax stays there. Let her drip, let it stop dripping, get nice and opaque. Now what we're going to do is we're going to put a plastic bag over her hand. Okay, cover that up. Let's have you come over and sit down. Of course, we have a stable chair in here. comfortable. Okay, then what we also want to do, so the plastic bag is to protect clothes and linens from the wax, okay? Again, cleaning up wax, wax and linens, you might as well just, as far as I'm concerned, get a new one, and throw it out. But the towel is gonna help keep the heat in. So, I'm gonna wrap it, we wanna make sure and enclose the fingers. Wrap, and then go ahead and have her elevate her hand, or her foot if you were doing her foot. We won't do feet, we'll just do hands and wrists. So we have a bell and timer in place. Treatment times about 15 minutes. It's 15 minutes because after that it starts to get pretty cool. Okay. But we're still going to come back at 5 minutes. What you don't want to do is unwrap the whole thing because you're going to have it cool off a whole lot faster. So just come down and just take a look right at the edge of the skin. Okay, make sure she's not super red. Make sure there's, you know, nothing happening right under that part. Anybody in here allergic to paraffin or glycerin? All right, so we checked, everything looks good. And cover, sit comfortably, more comfortable.
This is where we would put a towel on her elbow.
You can do that. You can do that. You could turn this. Just so the hand's a little bit higher than the elbow. You could use a regular pillow. It doesn't have to be this one. Certainly going to ask her, does it feel nice and warm? Does it feel too hot? Okay. Should also have asked her as we were dipping it, the first one's going to feel a little hot, but it should be a comfortable heat. Okay, and make sure as they're dipping it that they are still comfortable with that heat. Okay. Feel good?
Yeah.
Not often find somebody who doesn't like it. It'll be very interesting to see what you guys come up with. Because for whatever reason, classes usually go towards one thing or another. I had one class where nobody liked paraffin. It's like, how can you not like paraffin? Best thing. My old job, at the end of the day, all patients were gone. I worked in a hospital. All therapists would all go down there and dip our hands, hang out for a half hour, and then go home.
Do you always dip it in 6 times?
6 to 8.
6 to 8.
You want to get good layering on there.
Okay.
All right, so we checked her at her 5 minutes, and now her 15 minutes is up. So we're going to say, let's come on back over to our paraffin machine. Okay. Take the towel off. This up. Okay. Bring your hand over the machine. So now we're going to peel this off. Nice and easy. And then go ahead and peel that right off. Okay, now you can stretch your fingers out. Pull it out. So do I want to put it back in the wax like this or ball it up?
Just like that.
Why?
It's easy to melt it.
It'll melt easier, right? Okay, so we just put that. I'm going to check her skin. Okay. Make sure it's just normal redness. That'll go in 30 to 60 minutes. Now, because it's got that glycerin in there, it's like moisturizing. So I can say it's up to you. If you'd like to leave that glycerin on there, that's fine. If you'd like to wash your hands, please go ahead.
Just gonna leave.
Okay. And then cover that up. Okay, clean up. Questions?
I have a question.
So you as a therapist are touching the wax as you're removing and you put it back. Seeing that you had the patient wash their hands before, I'm assuming we wash before removing it as well.
Well, and you always, when you're working with your patients, always wash your hands first, right? First and last. First and last thing you do. Yes.
Do clinics usually reuse the wax like that, or is there ever a case where they throw it out or anything?
I have never seen a place throw it out after every single one. That would be super expensive, not to mention super messy, okay? Like, if you wanna clean this out, I let it like half harden to get it out of there, because if you try to just pour this out, it doesn't have a nice little pour spout, it will be all over.